Here now is Dr. Shealynn Buck, Chief Medical Officer with Lockton People Solutions. Shealynn, good morning.
Good morning.
Who has it right here? Do we need to be more concerned about our food supply? Do we have safety protocols that have been moved out of place because of the new administration? Or is Secretary Rollins right? We have nothing to worry about.
Let's start with really understanding Cyclospora, which is a parasite that is spread via contaminated food. And we do see Cyclospora typically this time of year. We'll see isolated outbreaks, and of course, for those individuals that are infected, it is not fun. It is results in GI distress, and that can go on for weeks. But what the good news is that this does not, it isn't a person-to-person spread. So as we hear the word outbreak, sometimes we're conditioned to think that, oh, this is something that can spread widely. It really is focused on food, and the surveillance, the investigation is on identifying the source of that and containing the source of that. And so in terms of, we've seen this before, this isn't, Cyclospora isn't new, but certainly, folks don't need to panic about this, but certainly need to take precautions that, cooking can kill the parasite. But just simply washing produce, it doesn't. And so I think it is important to think about the source of the produce, as well as making sure that you're cooking what you're eating.
Dr. Buck, this could have happened then even if different protocols had not been cut with the FDA and things like that, is what you're saying.
Absolutely. I mean, we've seen this before. And I think, where we spend a lot of our time is really focused on the intersection of healthcare and health and employers. And so the questions that, we're asking and keeping our fingers on the pulse of are, how is this affecting American businesses, American workforces, especially in those areas where we're seeing these, these focused centers of an outbreak, and thinking about those are employees, those are workers who are need to go into work. And so letting employers know, one, what this is, that it is not person to person spreads. They don't need to worry about that happening within their companies, but also that they serve as a really trusted source. And we've seen research on this, that employers serve as a trusted source for health information. And so, employers being understanding what this is, and also being, a channel for communicating to their people that, what's happening, that they need to see their doctor. If they have prolonged GI illness, they need to check with their doctor. Routine GI testing, like stool testing, does not pick this up. And so you have to have a high degree of suspicion in order for the right test to be run and for the diagnosis to be made.
Dr. Buck, I heard you say earlier when we started chatting, you like, Nick, cook it. It can be destroyed. This parasite can be destroyed by cooking. And you mentioned washing. I am guilty of buying the bagged lettuce with the big stamp across, ready to eat. You're saying, no, it ain't ready to eat, Nick. You need to wash that lettuce.
And that's what we're really seeing, is that, especially with the iceberg lettuce, that, it's bagged lettuce. And yes, it's triple washed, but that doesn't necessarily reduce all of the potential food borne parasites like Cyclospora that can be transmitted. I mean, Cyclospora is a pretty rigorous parasite, and so you're right. As we think about those food products that say they're already triple washed, that doesn't apply to this parasite.
Well, Dr. Buck, I want to thank you for helping us break that down, that it's not about whether or not agencies have cut back. Food still needs to be washed, and you have complete faith in our food supply as well?
Absolutely. Although I do have my herb garden and my backyard garden. And so, I like to, keep my food close to home as much as I can. But certainly I have absolute confidence in our food supply.
Note to self, ask Dr. Buck to send cilantro. Got it.
That's right.
Dr. Buck, thank you so much for joining us.
Thank you very much.